Our topic this hour is our first aid for stroke victims before treatment. Stroke is one of the diseases affecting many people. In fact, it is one of the 4 deadly killers today. According to the Medical News Today website, during a stroke, the brain does not receive enough oxygen or nutrients, causing brain cells to die. A stroke is the sudden death of a portion of the brain cells due to a lack of oxygen. Please explain some way. I repeat, a stroke occurs when blood flow to the brain is damaged, resulting in abnormal function of the brain. It causes by blockage or rupture of an artery to the brain. A stroke may cause paralysis, speech impairment, loss of memory and reasoning ability, coma or death. A stroke also is sometimes called a brain attack or a cerebrovascular accident. Strokes need to be diagnosed and treated as quickly as possible in order to minimize brain damage. The most effective way to prevent stroke is through maintaining a healthy lifestyle. Our guest today, Dr. Pieternel van Exter, is the head of quality care of Ambulance Amsterdam and currently the chairman of Dutch Association of Medical Managers. She will be treating this topic with us now in the studio. So tune in or join us by calling the telephone number 02737 1619 to interact with this doctor. So welcome to Radio Voice of Naija Good Morning Show, Dr. Van Exter. Welcome.
Good morning. I'm very happy to be invited here because I really think we can make a difference when it concerns stroke. We can really even save lives.
Yes.
So it's really important to talk about it this morning.
Thank you so much for being with us, and we always value and appreciate the effort you make to come to us to throw more lights on things we're supposed to know. So we appreciate it so much.
Thank you.
Thanks. So let's go on now. So can you please tell our audience listeners what stroke is all about? Because sometimes we are hearing of stroke. Some of us don't even know what it is all about. So I want you to speak about it in a general form whereby a layperson who didn't go to school very well will be able to know what stroke is all about.
Yes, I'm happy to do so. You already gave a summary about stroke, but we can elaborate a little bit on it.
Yes.
So as you told, stroke is a brain attack.
Okay.
It can happen to everybody. It can happen anytime. So it's really something which concerns all of us. And it occurs when a blood vessel bringing blood and oxygen to the brain gets blocked or ruptures. And when this happens, brain cells don't get the blood they need. And the brain cells then suffer from lack of oxygen and they die. Then the part of the body they control cannot function. So the abilities that are controlled by that area which doesn't get blood makes the body not being able to function. And so, like you said already, either muscle weakness occurs or speech is lost. That are the most important signs of stroke.
Yes, yes. My question is, what is it that can cause the brain to lack oxygen? because I heard you just made mention that any person can have stroke
Yes.
at any time.
Yes. Yes.
So what is it that can cause the brain to lack oxygen?
It's all about the vessels, the blood vessels. Like a heart attack is caused by a blood vessel which is blocked. Also a brain attack is caused by the blood vessel. The blood vessel cannot give the blood to the brain,
Yeah.
so then a part of the brain dies. And this blood vessel can be damaged mainly, most often, by hypertension, by high blood pressure. This is the main cause of damage to the blood vessels.
Wow. So these blood vessels, do they die spontaneously? I mean, without any indication that they are dying, and all of a sudden it just dies, or does it die systematically? So that, I mean, you need to throw more light on this. So
Yes.
how does it really die?
Yes. Well, it's not dying in a split second, but it's lack of oxygen.
Yeah.
So they really crave for oxygen, and the vessel is blocked or ruptured and cannot transport the oxygen towards this part of the brain. So it's dying slowly. But after about 6 hours, it's permanent. The damage is permanent. And that's why we really have to see it as an emergency.
Yeah.
If the first signs arrive, you have to be very fast.
Really?
So we made a chain of treatment,
Yeah.
so that if somebody calls 112,
Yeah.
we come with high urgency, we come to the patient, and also we warn the hospital should be ready to treat the patient as fast as possible.
So, so this happens within a space of 6 hours.
Yes.
You said.
Yes.
But before that space of 6 hours, does the person get some symptoms or indications that stroke is coming?
Yes. Yes. The first symptoms, when there's a lack of oxygen, you get already the symptoms about a certain weakness of your muscle, of your arm or your leg, and mostly it's at one side, and it can be both, it can be arm and leg. And also you see, if you're with somebody who gets an acute stroke, that he has trouble speaking, has slurred speech, he doesn't find the words, he doesn't understand what you want to tell, all kinds of problems with speaking are very familiar. So that's already at the start of the stroke.
Yes.
You can see these problems.
Really? Wow. So you made mention as well that a stroke can strike at any time, and from which age can people begin to expect stroke? Because does it happen to children or youths?
To children and youth is very rare.
Okay.
Yes, but unhappily, people from African origin are more prone to stroke.
Why?
I don't know, but they are also more prone to hypertension. And as I said before, hypertension is the main cause of stroke. So from the age of 35 on, you can already have a stroke. So you can have a young mother with children, and she's not taking very good care of herself. She's being overweight, she's eating fast food, she's smoking maybe, and her doctor maybe told her already, you have hypertension.
Yes.
But she doesn't feel it, because hypertension is a silent killer. You don't feel that you have a high blood pressure.
Okay.
So she lives on, and she takes care of her family, and she doesn't take care of herself well enough, and bam, at one moment, suddenly, without any cause, indication, she feels one side is paralyzed, and she cannot speak. And if you're not very quick then, it can become permanent.
Yes.
So a young woman can be permanently disabled by this.
Really?
And for the rest of her life.
Yes.
So this is really something serious.
So you made mention that is peculiar, or is more common with the African people from the African descent.
Yes.
Is it because of what? Probably they have too much of stress or too much of problems. Because high blood pressure, is it not as a result of too much of stress and our system of maybe feeding? Please just tell me.
Yes.
Throw more light on that.
Yes. Well, it's mostly to do with healthy lifestyle. So it has to do with smoking, of course.
Smoking, but African people don't smoke too much.
So that's not really the cause. It can be genetic why it's with African people, because the AMC has done a lot of research in this neighborhood in Amsterdam Zuidoost, and they found that there is more high blood pressure here among the African people, African origin people.
Yeah.
So this can be maybe the food habits, not much exercise, overweight. Those are the things you have to think about when it comes to high blood pressure.
Yes.
And also I think from 35 years on, you should check your blood pressure every year with your general practitioner, so that you know in time that you have a high blood pressure, and you can take measures, you can take medicine for it.
Okay, can it also be hereditary?
Yes, there's a genetic part of it. It's not that every child of a mother or father with high blood pressure will get high blood pressure.
Yes.
But yes, there's a hereditary factor in it. Yes.
Wow. Well, somebody out there listening to this broadcast is coming live from Radio Voice of Niger, and we are dealing on the topic of first aid for stroke victims. What they're supposed to know and what they're supposed to do before even the ambulance comes. So, Dr. Van Exter, who is the head of the ambulance care, quality care, is right here in the studio live. So give us a call on 020 737-1619 to ask for questions. The lines are open, so you are free to call us now. Dr. Van Exter, is there anything like a mini stroke?
Yes. There's something like a mini stroke, which means it's transient, it passes away again. So you feel the symptoms like weakness of one leg, one arm, or speech problems, but it can pass away again. So it's temporary. It means the vessel is not blocked completely, but it's narrowed for some time. And then the symptoms go away and you think you are okay. But mind you, it's a precedent. It's a sign of danger.
Yes.
So even if it passes away, you have to take it very seriously, because it can be followed up some days later, some weeks later, by a real stroke, which is permanent.
So how often would that mini stroke last?
It lasts from seconds to minutes, but even after hours it can pass away. So if we take you by ambulance to the hospital, maybe on the way to the hospital already the symptoms pass away. Or when you call the ambulance and before the ambulance arrives, it already passes away. And we call that a mini stroke, a transient ischemic attack.
Okay.
TIA.
Yeah, TIA. Yeah. What do you say? What do you call it?
Transient ischemic. That means oxygen lacking attack.
Yeah, TIA. So I heard of TIA, but then I was wondering what is TIA.
Yes, it's temporary.
Yeah.
Yes.
Really?
But it can be followed by a real stroke. So it's a
so
sign of danger.
Exactly.
Yes.
So that can, the duration of that is just within a few minutes.
Yes, but it can last for a few hours as well.
So within that few hours, does the face shift and the hands become, those symptoms, do they?
The symptoms start at once. The moment it's blocked, the symptoms start.
Tell us the symptoms. For
Well,
somebody who is out there listening,
yes.
Just pick up your pen and get the symptoms, and so you can know how to watch your body and know how to watch somebody who is next to you. Yes, the symptoms.
Yes.
Shifting of the face?
Yes, first of all, it's the paralysis or the weakness of one side of your body, which includes also the face, you're right, and the arm and the leg. And so if somebody tries to smile or show his teeth, you see that the face droops at one side. It's weak at one side. So if you're not sure if it's happening, you ask the person. And sometimes also of course with the one leg it's hard to walk, but also there's some kind of dizziness. It's
So the what happens to the leg? The leg shrinks or what?
It's weak.
The leg loses power.
Yes, it loses power. Yes, that's the word. Yes, the leg or the arm. We often when you call 112, they ask you to do this test when you have to put both arms up.
Yes.
And you will see that one arm falls down. It doesn't keep the power to stay up.
Yes.
So you can see it's weaker.
And all of this is really, you see, I'm looking at you with surprise. It's really, so all of this can spontaneously happen.
Yes, it is. Yes. And even with relatively young people it can also happen, which makes it even more important to prevent it.
So, now, can somebody be sleeping and this happens?
Yes.
Or is it just when one is doing some strenuous job?
No. It can happen in your sleep, and this is very difficult for the doctors, because then we don't know how much time has passed.
Exactly.
Yes. So if it happened when you started to sleep, it's too late to make a difference. It's permanent damage. But if it happens just before you woke up, it can still be...
What do you really mean by permanent damage, if I can understand, please?
Yes. Well, we talked about the signs of paralysis and weakness of the limbs and the problems of speaking. And if we treat it very fast,
yes,
we call it time is brain. Every minute passes, the brain has more damage. But if we treat it really fast, we have a chance to make it better, to relieve the symptoms.
Okay.
But if the brain has been too long without oxygen, then it cannot, it's dead, that part of the brain, it cannot repair. So then you have permanent paralysis and permanent problems with speech or understanding of speech, which is the homes for the elderly are filled with a lot of people who have those problems.
Here?
Yes.
Oh, wow. This is very, very terrible.
Yeah, it is. It's, as you said, it's a cause of death, of course, but also the
So how long can one stay in that condition before then he passes on?
That depends on how, on which vessel is destructed. If it's a small vessel, small part of brain, you will not die from it. But if it's a big vessel with a big part of the brain...
but even if the person didn't die, the person will remain paralyzed?
Yes. Yes, if not treated right away, he will remain paralyzed. Yeah.
Right, yes, you can ask your question, please.
Well, I'm wondering, from your study, which parts of the brain get the most attack of this lack of oxygen, resulting in a stroke, and which parts of the body get affected by this lack of oxygen supply to the brain, from study so far?
Yes, the signals I talked to you about are from the part of the brain which is most affected. It is possible that other parts of the brain, other vessels are affected, and then you can get other signs and symptoms. Then you can get loss of consciousness or a severe headache suddenly. There are other parts of the brain which give other symptoms, but the stroke mostly gives the symptoms of the muscular activity, and it's at the cortex of your brain, and the part where the speech is coming from.
Yeah. So, are there some people in your practice that you have seen who couldn't recognize some symptoms of stroke? They couldn't recognize that was stroke coming to them.
Yes, I think in the beginning, if somebody is not very alert, and that's why we're talking about it today, you can think, oh, I feel a bit weird, I have some weakness, but it will pass away. So you will wait and see if it passes away, because you don't get breathing problems or heart problems. You think, oh well, I feel a bit weak at one side, it will pass away, I didn't sleep well, or you make excuses for yourself and you don't recognize that it may be a stroke. So then you wait too long. And that's what I really is a key message today. Don't wait if you suspect a stroke. If you feel something like numbness or difficulty speech, don't wait, just call. And don't call your GP in that case, because it's really an emergency. You have to call 112.
Well, somebody out there, you've heard it, that if you begin to examine yourself and you feel that your speech, you are beginning to have speech impediment, and at the same time you are having some weaknesses in your legs, and your face is dropping, is that?
Yes.
And then your arm cannot stand up,
yes.
Then you just pick up your call, pick up your phone and call 112, not your house doctor, because it may be too late.
Yes.
So those are symptoms of stroke.
Yes.
Is that?
Yes.
Right. So please take that information again. When your face is dropping, and then your hands can no more stand, one is dropping, and then at the same time you are having weakness in your leg, and you cannot speak very audibly, and you cannot speak constructively, please remember that can be symptoms of stroke coming. So you call 112 and not your house doctor, so that they can come immediately to... Is it the ambulance that will be coming to pick the person?
Yes, that's true. Yes. And also I would like to tell you what happens when you call 112.
Yeah, yes, we would like to know that.
Yes, because sometimes people are think, well, we have an emergency, let the ambulance come right away, and then they get frustrated because there's a lot of questions asked.
Yeah.
And I would like the listeners to be patient with the dispatcher, because those questions are not for nothing. So when you call 112, first they ask if you want police or fire or ambulance. Of course you want ambulance.
Yeah.
And then they will not listen to your story. They want your address. Because if anything happens with the telephone line, they want to be able to come to you.
Oh, okay.
So they don't listen to, no, they say your address. What's your address? What's the address of the accident?
Okay.
And then they ask your telephone number. Because if there's something wrong with the line, they can call you back.
Yeah, yeah. Okay.
So don't get impatient. The third question will be, tell me exactly what happened.
Yes.
Now, it's a bit, it would be nice if there's somebody around the person with a stroke who can speak Dutch, because then you have the Dutch question and you can give a Dutch answer, and not all the dispatchers are speaking fluently English.
Yes.
But they can also help you in English if it's necessary.
Okay.
So then you have to know that once you've told what's happening, they will ask if the patient is still conscious and if he's breathing. And then you think, oh, all those questions, the ambulance has to come, the ambulance has to come. Don't worry, because at the same time the dispatcher already gave a sign to the ambulance.
Yeah, okay.
So the ambulance is already driving towards you.
Oh, okay.
They're still talking to you and asking all these questions, but the ambulance is already on its way towards you.
Okay.
So keep your patience and just answer the questions.
Yeah, exactly. This is so necessary, because they come out wondering why all these questions. And some of them say ambulance couldn't come early, and they were just busy asking questions.
Yes, it's true.
Okay.
Yes. So even after the ambulance is riding, they will still ask you to do those tests like we talked about before.
Yeah.
If you can, if the face is dropping, if the arm is dropping, if if the speech is slurred, and they will, of course, ask you, what time did it start?
Yes.
Because the time it started
Yes.
is essential for the treatment being still able to give.
Yes. So in this case, one has to be very exact.
Hello?
Yes.
You don't need to sugarcoat it.
No. And if you don't know, you tell them you
Yes,
don't know.
hello?
If it's like during sleep,
Oh, I mean,
you
the
tell them
Mr.
it's
Dillon,
during
can
sleep.
I
You
Yeah.
don't know
you
which
coming?
hour exactly, but as exact as possible.
Yeah.
Yeah.
Okay.
Okay.
All right,
So
that's good.
then, what's the next question? After telling them the time,
Okay,
and then what's the next they want?
The next
Oh,
they
that's
will give
good.
you some
Okay, that's good.
instructions.
They
I'm in
want
the
to
studio
know
now,
whether
so
you have
okay.
sniffles.
Bye-bye. Yeah.
No. Never. No. And also not your name or your birthday.
Oh, you don't ask that?
Not yet, because it's an emergency.
Okay.
So what we want to do then is to give you some instructions, that you open the door, that you have the medication, if a person takes medication ready, that everything is ready to be very fast.
Let me ask you, Dr. Van Exter. So, do they give this treatment, or can ambulance come even in a case where somebody is not legally documented?
Yes, of course. Yes.
Oh, really?
Yes. That makes no difference whatsoever. So we don't ask in the telephone for legal or not legal,
Yeah.
or insured or not insured. Makes no difference.
So they will just pick the person and then begin to drive the person to where the treatment will be administered?
Well, they check first, of course, if it's a real stroke.
Yeah.
If it's necessary to go to the hospital. And if it's necessary, yes, they will pick up the person, and then, of course, while on the ride to the hospital, they will warn the hospital so that they are ready to be very fast treating the patient. And at the same time, of course, they will ask your name, your date of birth, and your insurance if you have one.
But if the person doesn't have,
then you still will be treated, because emergency treatment is always given to everybody. You cannot let somebody die or stay paralyzed without treatment. That would be cruel.
This is good to know, that people who are not documented can still be treated in an emergency case.
Yes.
Oh,
they have to be treated, yes.
So there's no need now for them to be shying away, because some carry their sicknesses and it's like they don't have insurance, health insurance, and they don't know where to go. They carry their sicknesses and then they die. You see?
Yes, they risk their lives with that attitude to arrange help.
Yeah.
But for emergency cases like this one,
Yeah.
you can save a life or prevent paralysis for the rest of your life.
Yeah.
You really have to call 112 and go to the hospital.
Exactly. Thank you so much for this wonderful piece of information. So before we take a short break, I want to know if somebody is standing, a bystander, what would that person do to help somebody who have just had stroke?
Yes, well,
You know, somebody
yes,
who's
of
just
course.
watching and
Yes.
probably just happened along the road or
Yeah.
whatever.
Yeah.
So what is the right thing for that bystander to do in helping somebody who have gotten a stroke?
Yes. The first thing is that when somebody has a stroke, he has trouble standing up, so you help him sit down or towards the laying down, so that he cannot hurt himself by falling. And if he's laying down, sometimes you don't know, as a bystander, you don't know if it's a stroke or an epileptic insult or a cardiac attack. You don't know, but you can just be there for the patient, and if the patient loses consciousness because it's either a very bad stroke or some other cause, then you have to, like first aid always learns you to lay on the side so that he can breathe without problem. Breathing is the thing you have to really, as a bystander, see that the person can go on breathing.
How would you do that? By
Well, you check if he's breathing, and if he's not breathing, you put him on a side and you see if that helps, if he's not blocked his airway by something. you call 111, and if really a person is unconscious and not breathing, you should start CPR, because then you don't talk about a small stroke anymore. Then somebody is having probably a heart attack and stopped breathing and lost consciousness. So then you have to do your basic life support.
Wow, wow. Well, thank you so much, and somebody out there listening to this broadcast on first aid for stroke victims, should you want to make contact with the doctor, she is here in the studio of Radio Voice of Naija. You can give us a call on 020-737-1619. Even as we take this break right now, still feel free to call us, please. You just have to call 112 when you want to reach Dr. Vanessa. Welcome back to Radio Voice of Naija. Doctor, please, welcome back.
Yes, I want to correct you, because 112 is not for calling me.
Of course I do. But I cannot give them your direct number.
Just call 112 when there's a real emergency.
Yes.
But don't hesitate. If you think it's a stroke, call 112.
You've heard it by yourself. So, doctor, please, what are some of the effects of a stroke?
Yes, a stroke, the effects may be permanent. Some people recover completely from strokes, but more than 2/3 of the survivors will have some type of disability. So stroke is the number 4 cause of death, but it's the most important cause of disability.
Oh.
Yes.
So the person will be disabled for life?
Yes. And since it can happen already when you're in your 40s, it's a long life you can be disabled. Yes.
So what are some of the problems one can have after a stroke? Disability, okay, and what else?
Well, the biggest problem, of course, is, aside from the paralysis, is that your communication gets very difficult.
Yes.
It's different kinds of problems which can occur with a stroke. One is you cannot understand what somebody is telling you.
Oh, is it?
So then you're really lost in this world. You cannot understand anything, like everybody is talking a strange language to you. You cannot understand what they're talking about. Maybe sometimes you hear 1 or 2 words, like
really?
French, or if we hear French.
Yes.
But you can't make sense of it when you have a stroke in that area.
Are you saying?
Yes.
Are you saying that apart from the physical disability, they have the disability of, making sense of what people are telling them? They cannot hear very well.
Yes, they can hear everything clearly, but they cannot understand what's being said. That's one kind of a stroke symptom. Not everybody with a stroke gets that.
Yeah.
But it can happen, and it's really debilitating. Yes.
They can hear, but cannot understand.
As if you're talking a strange language.
Really? So the brain gets so damaged that it cannot process, let's say, a voice.
It cannot process what they hear.
Really?
Yes.
Then it's very bad.
Yes.
It's really bad.
Yes, this is very bad for everybody around, somebody who loves him and who cannot speak anymore with him.
Really?
Yes.
No. Okay.
So how do they? Are they being taught the language again?
Yes, I don't. Like we said, I'm from the ambulance care, so I know I'm not pre-hospital, but I know that there's a lot of effort being done, if the stroke is permanent, to try to recover even small parts of this speech and understanding ability, because it's so important in our lives.
Really?
So they have all specialists like logopedists.
Yeah.
Things like that.
Okay, so let me. So now they begin to learn at that age, maybe 40s, 50s, whatever.
Yes.
how to communicate verbally, how to speak.
Yeah. Yeah.
Like children, they are taught to speak.
Yeah. Yeah.
And
And sometimes it doesn't even, the part of the brain which is processing is not repairable.
yeah.
So it doesn't even, well, it helps you to cope with life, but you cannot get all the
Functioning
understanding
back.
the functioning back. Yes.
Okay, thank you.
So this is something people with hypertension
Yeah, should be very careful
they
about.
should be very careful about, because if they don't take their medicine and their tension destructs their vessels, they don't feel it happening, but one day they get a stroke, and then the rest of their life they have problems. Yes, serious problems.
So what can one do to reduce the risk of having stroke?
Well, to prevent the hypertension, of course.
Okay.
And if you're still young and it's important to have a healthy lifestyle, so you don't get hypertension. But once you have hypertension, and you should check it every year from the age of 35, then you have to get together with your general practitioner.
Yes.
And to see that you get the medicine to get it lower. Even if you don't feel any pain or signs of your hypertension, be aware, because inside it's destructing your vessels.
Yes.
So you really have to take medication to keep it low, low, low. Yes.
So the feeding habits as well can be changed?
Yes.
The eating habit?
Yes. You already had sometimes a broadcast, I think, about hypertension, and the feeding habit is very important. The low fat, low salt diet, but also the exercise, the physical exercise.
Yes.
And don't eat fast food, but eat fresh food. Things like that. It's very important to keep your blood pressure healthy.
Wow.
And especially, like we talked, for people of African origin, there's more danger, so you should be more aware.
Any other information that you think is necessary for this broadcast we need to know?
No, I think the key message are two things.
Yeah.
The prevention, we talked about it already, to prevent hypertension especially. And if it happens, the emergency, that you really have to call 112 at once.
But do you have any place that people can always go, information desk, to be able to get information regarding to or how to avoid stroke? You know, because I think information like this doesn't just need to be shared once. There must be a place that people can easily lay hands and, you know, at a very crucial corners, they can easily pick up those information, you know, as to how to guide themselves from getting stroke and this and that, you know, because such a deadly disease, I mean, it's not something that we just have to keep calm about it.
No.
You know?
No, because you can make such a difference.
Yes.
If you're aware of it, you can.
Yes. Bring that awareness to people. Yes, exactly.
And also you can treat it earlier.
Yeah.
I think the internet is always a good source.
But what about those who cannot go to the internet?
They should go to their general practitioner, to their doctor, and talk about it, because the doctor also knows it's a very serious problem, and they can guide you personally to see your lifestyle, your way of coping with it, and if you have extra dangers, or you do everything you can to prevent it. So those are the two. But if you can get to the internet, and also in English, you have the Nederlandse Hartstichting, but also you have the American Heart Association, and the American Heart Association gives a lot of information also not only on heart but also on stroke.
Yes.
Because stroke and heart attacks are both vessel disease. Yeah, they're connected in that way.
All right. Okay. So that is it. So as you are about to leave now, or we are about to sign up, so the three things you want the migrant community to understand, more especially those from the African descent, are what?
To prevent the stroke.
Yes.
to have a healthy lifestyle, to check your blood pressure, and if it happens, to call 112 immediately. Those are the 3 real important things.
Yes.
But to be able to call 112, you have to recognize the symptoms.
Exactly.
Like, this is why we talked about the symptoms.
Yes. Yes.
If you have numbness or weakness,
yes.
one side
yes.
suddenly,
yes.
you don't know why,
yes.
or your speech is slurred, your face is dropping, call 112 because it might be a stroke.
It might be a stroke. Thank you so much, Doctor. Thank you for being with us today. We hope you have enjoyed the broadcast too.
Yes.
And we hope to have you again.
Thank you.
Thank you for being with us.